So welcome back, everybody. And for today's lecture, we are going to be looking at health literacy. And we are also going to be looking at, this session really focuses on developing material for your presentation, for your various site visits. And we will actually explore some of the significant tools that are used with the American Medical Association Literacy Guide. And in terms of health literacy, I'm not sure if you have actually heard that term before or if you have kind of included them in some of your lesson plans. But, it is really a very, very useful tool and it's also a really big one, especially a lot of times and the basic definition of health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information, tools, and services needed to make appropriate health decision. And so, we have to kind of look at health literacy levels for different population groups. And so kind of looking at what is health literacy for an adolescent kind of look like? What is health literacy for a child kind of look like? What about non-English speakers? And so again, we really have to look at it in terms of like plain language. How can you take something like a complex process and put it in the most basic form? And that's really an art. And this is actually one of the key things as you continue to develop your materials and your lesson plans. I think that this is just a really very important tool to kind of consider, because you've spent all this time throughout your university years looking at all these complex processes. You've learned all these various nutritional concepts, nutrition biochemistry. But how are you going to simplify it to make sure that your target audience kind of understands it? So basically, like, how do you put it in a way that even your grandparents can actually understand it? And so some of the barriers to understanding that we often encounter are the choices when it comes to your words and also phrasing. For example, I remember having a question about what is net income? And you might think that that's a fairly common term, but especially when because the population group that I was working with was non-English speakers. And yes, I can actually speak multiple languages, but I'm sometimes, just like a phrase like net income. How do I explain it, particularly to an interpreter? And if let's say, for example, in Asia, we use a lot of Mandarin in Malaysia or Cantonese. And if I do not understand the language, how do I make sure that my interpreter understands the concept that I'm trying to explain? And so even terms like gestational diabetes can be really complicated. And sometimes when you say, fair or having like, adequate nutrition status, what does that mean? It can be really challenging, particularly for non-English speakers, or even for people who might be taking multiple medications or dealing with various illnesses. Sometimes when you give them medicines as well, a lot of times they might have like a scientific term. And so how are you going to explain that? Um, and many of when particularly you might have learned this in previous courses, when somebody's blood sugar is high, comprehension can be really difficult. So let's say if a person is kind of newly diagnosed with diabetes, and maybe is walking around with a blood sugar level above 15, 17, it's going to take a lot for them to understand and follow the process. And we also need to consider bigger factors like dementia, stress, or fear. These are all things that can impact someone's ability to understand and follow health-related information. Also, sometimes you also kind of need to look at, visual impairment. And sometimes the material can also be put up in a negative light. For example, with the indigenous group that I have been working with for my PhD, a lot of times, the kind of food that the government actually promotes for them is a lot of like canned food, processed food rather than fresh fruits and vegetables because they live in food deserts, basically areas that do not have are not really accessible to grocery stores, particularly if they live in rural areas. So sometimes when this material is presented, it's kind of like, again, not showcasing or not emphasizing the types of traditional food because they're basically hunter-gatherers. Many of them still kind of practice a bit of gathering and a bit of hunting throughout the year. And so, they kind of know that they are being brainwashed, and that could also be one of the reasons why, some of them do not want to interact with the material that's been provided. So what is it like, kind of putting your, kind of being in somebody else's shoe, maybe somebody who does not speak English, and when you kind of read, we kind of read this, and whether or not you're able to understand. So just take some time and read this passage and see if you can understand the crux of this material. And so if you're an English speaker, English is your native language, this is not actually going to be a problem, because as the passage says that we do not read every letter, but by itself, but the word as a whole, so we can actually figure this out. But if it's a non-native English speaker, and sometimes when you kind of use really complex medical jargon, will they be able to understand? So you kind of need, when kind of developing your material, you want to make sure that you take that into consideration. And I'm pretty sure all of us have kind of been in a situation where you have received some really bad news, whether with a family member or whether it's yourself, and you just do not want to understand or comprehend what's being said afterward. So, for example, if somebody was just diagnosed with cancer, after you hear the word cancer, maybe you just do not process anything at all because you go into that state of shock. So it's kind of like a stop sign, and so there's a lot of times when you go for like doctor's appointments, you always kind of need that emotional support. So someone else actually goes with your family member or with a friend just to kind of be there for them. And a lot of times what I notice is that particularly when people are experiencing chronic disease, it's always good to kind of bring in a family member or somebody you're close with, because you know, after that person kind of hears the diagnosis, they might not be able to process, and the doctor will give you what the next steps are. And sometimes you just do not want to understand, you just do not want to comprehend things. So really, stress and fear does have a big impact on how well you understand. And of course, then there are visual and hearing impairments. That's always going to be a challenge, also for the organization of material. So, when you're kind of working with an interpreter, and let's say you're talking to them about teaching this immigrant group about breastfeeding, and you have to really make it into a language, make it into really very, very simple, basic English so that the families can understand. And if you use complex medical jargon, they're not going to be able to comprehend that, and the interpreter will not be able to, especially if you do not know the language, you're not sure whether the interpreter got the message across like effectively. And so I remember as well with the Hmong population and with the group of students that I was working previously, they try to make it as simple as possible for the interpreter, but then the interpreter was like, okay, this is too simple, and we have multiple terms for breastfeeding, and it's not going to, she didn't know how to get the message across effectively. And sometimes as well, with education, people who might have limited resources, that could also affect your overall literacy level. So you really need to understand the community that you're working with. What is their education level? What are their graduation rates? Or, anything else that you can think of that might potentially interfere with your barriers to understanding. And so, you can take some time to kind of think, these are just some of the things that I could think of that, how health literacy can really affect different population groups. And why this But why does it matter? Why do we spend so much time focusing on health literacy? And actually, this is one of the main objectives because, you know, why health literacy is so important? Because sometimes people don't understand what they're being told. Even if you have documents, you have charts, you have like all your material kind of present, they still might not be able to grasp what you're trying to get at. And that's what it basically boils down to. And we really want to make sure that people fully understand uh, the different kinds of whether it's a nutrition education plan, whether it's not, what kind of treatment plans that you have. And a lot of this is actually contributed to the various kinds of health disparity. So again, if we start looking at the family, and if they're from lower socioeconomic backgrounds, will they be able to understand and the material? Will they be able to read the material? And I know, sometimes when you go for a doctor's visit and maybe you're diagnosed with something and then they just give you tons of information, a folder load of information, and they send you home. And sometimes it could be 50 pages, 70 pages. Okay, this is what you need to do. And we know that the internet, so you just have a lot of information, but where do you start? You don't even know where to start. And that's why those things, even when if you kind of look at working together with families, I know when I arrived here, I went to see a WIC clinic, and they have just a huge room that is just filled with various kinds of education flyer full of information, but is it still relevant? Are people going to read it? Are people able to understand that? And that's something you really need to kind of think of. And you want to look at the simpleness of it. And that's why, infographics are really great because you can put all this information and make it really very simple and put a picture there next to this main concept and, use a few words to kind of just describe that. But again, just a picture that can kind of illustrate the whole entire concept, that's going to make things a lot easier and that's going to help people understand. And sometimes, for example, if somebody's just being diagnosed with something and you just give them this whole folder of information and you say, go back, take 2 weeks off, go through all this thing, and we're going to talk about this later. Are they going to be able to go through this information themselves without starting to worry and having anxiety, and then trying to like, oh, I have this disease instead. So really, when you go and see your primary care physician, make sure that you have all your questions ready, bring a piece of paper, write down what they say, and so, trying to make it in a way that the person who's sick is able to actually understand, rather than sometimes when they give you this book or all this information and all these flyers, and if you've been newly diagnosed with diabetes, is that actually the most effective way? And you're not going to have, sometimes when you have just so much of information, that information overload, you might not be able to understand the material or even ask questions. So, especially when you're dealing with really stressful news. And also, people with lower health literacy levels may not have a complete understanding of their health problems and treatment. And so they are at actually a greater risk of hospitalization. And so what does low literacy mean? And what does it mean for the patient? And what does it mean for the provider? These are two really important things to kind of look at, because as you continue on in your career and when you start working together with various population groups, you have to be able to understand these two different perspectives, and you have to be able to counteract that. So, let's say if you're going to a home and you're visiting a mother and she has maybe 4 kids running around, and you're giving them all these like, questionnaires and sheets of paper to kind of fill out. And when you have this many kids kind of running around, they won't be able to concentrate and they won't have the time to kind of read it. So are you going to use them? And if you're using a lot, and let's say if you're giving them a lot of flyers to educate them on various things, will they be able to understand that information? And this is always a problem, I think, when with the ADRC, when they start to do home visits, with the elderly, even the same thing with WIC, and when they start doing house visits, sometimes they just come at a really bad timing, and the mother's interest is actually more focused on her children rather than, listening to um, listening to the person who's coming to teach them. And sometimes that will also kind of lead to decreased participation. And one of the main reasons a lot of home visitations do not work is that they feel that it goes way too long. That it's just that their concentration levels are not there. They have other things to kind of worry about, so they're not able to effectively get their message across. And at the same time, when you look at the uh, practitioners and their point of view. And when you spend all this time with a family and they're not able to, they're not participating, you can get really frustrated with the client family. And sometimes you may have like goals and targets that have already been set up by the various organization, and you're not going to be able to achieve that. And so that really kind of adds on to that stress. And so, it kind of increases the negativity. And so there are a lot of repercussions. So, how do you get them to understand? How do you get participants to understand to also participate and decrease the negativity associated with home visits? How you can turn that around. So this is just something to kind of think about as well. And so again, this is actually the AMA Health Literacy Manual, and it's something that you can actually pull up and you can actually look. And so what does it mean to have a basic or below basic health literacy? And this is actually some very interesting things, because 26% of participants or patients that they surveyed didn't really know when their next appointment was. And 42% didn't understand instruction to take medication on an empty stomach. So some medication actually you have to take that on an empty stomach. You might still be able to have coffee for some medication, but usually most of the time, you just have to kind of take it with water. And they do have like if you take it with food and anything like that, they can have like various kinds of interaction. And the little difference will really kind of affect how the medication is absorbed and the efficacy of it. And also 78% of the people misunderstand warning labels on prescription. And and you might think that it's not something difficult that most people will be able to understand, but that's not the case. Um, Also 86%, do not understand the rights and responsibilities section of the Medicaid application. Sometimes as well, some people can take medication with alcohol. Some medication you're not supposed to, it can make you groggy, so you're not supposed to drive after that. And those are some of the really big things that kind of affect the literacy levels. And about 14% of the American adult population has health literacy skills below or even the basic level. And so this is actually how you're going to help patients understand. And usually, a patient is actually suffering from asthma, um, they could actually be less likely to know how to use an inhaler. And so you might need to actually kind of teach them how to use that. They need to, again, that, getting people to practice the skills are really very important. And also, when we talk about diabetes, some people might not be able to understand what are some of the symptoms of hypoglycemia and hyperglycemia, and how could that affect their concentration. Or how could that how they might feel weak and really tired or fatigued. Also, um, patients with hypertension, they would not know that, maybe how to reduce blood pressure. Maybe they might think it's just taking medication, but exercise can be a very, very important factor. Um, Even thermometers, and this was something very interesting. I remember I was teaching a group of culinary students, and most of them didn't even know how to use a thermometer to measure the internal temperature of food. So even just a normal basic thermometer, sometimes young parents, mothers might not be able to know how to read it. And so just something that you might need to actually teach them. You should never take for granted that they'll be able to understand all this. And so when with this health knowledge deficits, they might less likely understand, the impact of mass media and television and also advertising, all these infomercials. And a lot of time people who tend to have lower health literacy may fall prey towards this various kinds of advertisements that may be readily available in television or even on the radio. And sometimes as well, when we talk about health literacy and when you're not able to understand some of these concepts, you might not know what are some of the impacts of smoking, especially how does it affect unborn fetus. And people with lower socioeconomic status, there's just a higher chance and a higher percentage of them being more exposed to violence. Also, sometimes you have to work multiple jobs, young mothers, and so they might not have the opportunity to actually breastfeed. And because healthcare is not free over here, they might have less access to like routine child's healthcare. And again, a really very they have a hard time kind of understanding preventive medication and the importance of establishing a primary care physician early on in life.